All right, let's jump right in. Today, we're going to talk about what it really means to be a business analyst in healthcare. You know it's one of the most complex, but also one of the most rewarding industries you can possibly work in. This is where cutting-edge tech meets real-life patient care, and a good BA can make a huge difference. But just a heads up, the challenges, they're every bit as big as the rewards.
And that really gets to the heart of it, doesn't it? When you're thinking about a BA career in healthcare, are you looking at a path of super high risk or one with an incredibly high reward? Well, as we're about to see, the answer is both.
It's really a tale of two sides. On one hand, you've got these immense stakes. You're navigating a jungle of complex regulations, and you have to remember that patient safety is always on the line. But then, on the other hand, you have the chance to make this profound impact, like reducing burnout for doctors and nurses and directly making patient care better.
Yeah, we're not just talking about another job here. This is a field with a real, tangible sense of purpose. The hurdles are massive for sure, but the rewards, they go way beyond just a paycheck. Let's dig into why that is.
Honestly, the best way to picture it is like this. Being a BA in healthcare is like trying to find your way through a giant labyrinth. Around every single corner, you're hit with a new rule, a new stakeholder with a different priority, or a new piece of medical jargon you have to get your head around.
So let's actually walk through that labyrinth together. What are the major challenges, the big twists and turns that every single BA in this field is going to have to deal with?
Think of it like this. The labyrinth has three main corridors you absolutely have to navigate. First, you've got the maze of regulations and compliance. Then there's the tangled web of stakeholders. And all of this is happening under the constant pressure of incredibly high stakes, where every single decision you make really, truly matters.
Okay, so the biggest beast you'll meet in that regulatory maze is HIPAA. And this isn't some guideline or a suggestion. It's a foundational U.S. law. For a BA, that means from day one, every feature you spec out, whether it's a simple appointment form or a complicated data report, has to be built to protect patient privacy. A mistake here doesn't just break a rule, it can cause a massive data breach and totally destroy patient trust.
And then there's that tangled web of stakeholders. You're not just dealing with a few key people. Nope. You're trying to balance an entire ecosystem. Doctors, nurses, hospital admins, the billing department, insurance companies, and even government regulators. A nurse needs a system that's fast and intuitive, right? But the billing department needs to see every single charge and code. And guess who's stuck in the middle trying to make everyone happy? That's you.
This brings us to the last, and frankly, the most critical challenge. In most industries, a software bug might cause some financial loss. And yeah, that's serious, but you can fix it. In healthcare, a bug can delay a critical lab result. It can lead to a medication error. That's why your attention to detail isn't just a professional skill, it's directly tied to a patient's well-being.
Now, I know that all sounds pretty daunting, but here's the good news. Every labyrinth has a way out. And in fact, it's these exact challenges that create the path to making an absolutely incredible impact.
And this is where things get really exciting. We're shifting from the challenges to the amazing opportunities. Because when you successfully navigate all that complexity, a talented business analyst can add immense, and I mean immense, value.
Let's start with a huge question facing the industry right now. How can a BA help solve the problem of clinical burnout? It's a massive issue, with doctors and nurses just buried under piles of administrative work.
Well, the answer is by driving efficiency. Think about it. By streamlining how patients check in, by automating billing workflows, or by designing a more intuitive electronic health record system, that's the EHR, basically the digital version of a patient's chart, you're giving clinicians back their time. You're letting them do what they're meant to do, take care of people.
And the opportunities just keep getting cooler. The healthcare industry is exploding with innovation. You've got telehealth, AI that helps with diagnostics, remote patient monitoring, predictive analytics for disease outbreaks. These aren't just buzzwords. They're real solutions that need a smart BA to connect that cutting-edge tech with the real-world needs of a hospital. You get to be right at the forefront of that change.
But, beyond all the efficiency gains and the cool new tech, there is one opportunity that truly stands above all the rest. It's the core reason people are drawn to this field, even with all the complexity.
This is it. The number one opportunity is the chance to directly improve and even save lives. When you design a clearer system for giving out medication, or you create a seamless way for a doctor to access a patient's history in an emergency, you are preventing errors. You are helping people get the right care at the right time. Your work has a direct human impact that almost no other industry can offer.
So, when you put it all together, what does it all mean? It means that being a business analyst in healthcare isn't just a job, it's a purpose-driven career. Now, it's really important to say this path is not for everyone. It demands a deep, genuine respect for all those regulations we talked about. You have to really want to solve incredibly complex problems, and you need an absolutely unwavering attention to detail.
But if you're looking for a career where your analytical skills can contribute to something truly bigger than yourself, where you can help solve real-world problems that have a meaningful impact on people's lives, then this offers an opportunity like no other. So the real question is, are you ready to analyze for a greater purpose?